Welcome back, everyone. We are in the third module of the course, which talks about scaling and ecosystem building and what is your end game? What is your exit in social entrepreneurship? Do you want to exit? And what does that look like? Today's guest is Daisy Rosales, my former student and mentee who graduated from SOM 5 years ago. It's so exciting to have you back, Daisy. Thank you for being here. I shared with my students that you took a red eye from San Francisco to be with us, and we're just so grateful.
It's really nice to be here.
So, Daisy, most of our listeners might not know that this is not your first podcast episode. You're another return guest. And in the first one, we talked about design thinking and design justice and how your organization partners with community organizations to pilot new innovations. And at the time, you were really focused on that co-creation process. And today, but it was always with the idea that in the end, you're going to partner with the government to scale it. And now your organization is 7 years old. And so you have reached that part where you're working on scale. So that's what we're going to focus on today. I'm really excited to have you here. But for those who aren't familiar, can you get us started by sharing a little bit about Brio and what it does?
Sure. And thank you so much for having me. So Brio, we're a nonprofit, and we partner essentially with community organizations and civil society to strengthen mental health. And we do this through, as you said, a design process to start off. We work with a community-based organization that is interested in improving mental health, particularly with the participants or the community members that they serve. And we create an effective mental health promotion program. So we're looking at ways to help individuals and communities in that particular context improve their mental health baseline. And then beyond that, we look at ways in which maybe if this model is effective and people really love it, how do we make it more accessible to more people in that context?
So mental health means so many different things. I think most people, when they hear about mental health, they think about like therapists or antidepressant medication or things that happen at the very end when someone is not feeling well. And I get the impression based on the organizations and communities that you've shared about that it is a case about people not being in their best health, but it's less about that treatment aspect and more about the social drivers of mental health. We've talked about social drivers of health in general, but never on the podcast, but never specifically to mental health. And I know that you shared with my students a little bit about how you got interested in mental health in your own life, in your own family. And I think that that's a great illustration of those drivers of health that the communities you're working with are addressing. So if you feel comfortable, I'd love it if you can share that part with us, like what mental health means to you and how and why you got so involved in it.
Yeah, I'm happy to share about that. And to just speak to your point in terms of the vast spectrum of mental health interventions and initiatives. On one side, we do have treatment and maintenance, and that's more in the category of looking at folks who are living with a mental health condition with a diagnosis. How do we want to respond to that? And then there's the other side of the health spectrum, which is health promotion and prevention, which is where Brio sits, and we're looking at helping people build some of that inner psychological flexibility, those inner mental health skills that help them to navigate life's difficulties. Everyone's life is challenging at one point or another. And so how do we want to respond to that in a way that reflects the kinds of people we want to be, our values? And so that's really the focus of what we do. In terms of what connects me to the work, so I grew up in a family that was affected by mental health conditions. I was an only child, and both my parents went through a mental health journey when I was growing up. And because I didn't have siblings, I didn't actually realize that it was unusual if
you had no one to compare notes with.
Yeah, exactly. And so, I didn't necessarily know it was unusual when, a parent couldn't come and pick me up one day, or when one of them decided, they didn't want to speak to anyone for days, and so I think, at the time I just thought, well, this is my family. And over time, I learned that, like, oh, actually, these are conditions that affect people in terms of their response to the really difficult things that have happened to them. And I should say that, my parents did their absolute best with what they were given. And one of the things that I had always wondered, knowing that they grew up in various forms of hardship, and particularly my dad, and just thinking about the community that he grew up in. What if there were a force in that community that was able to offer support to what his family had gone through, or some kind of space where he could go as a child and feel safe and nourished and all of that. And so for that reason, I became really interested in community-based leadership. This was years ago when I was just kind of fresh out of college. I discovered, like, oh, that, like, there are these people who live in different communities around the world who are organizers, who are leaders, who are recognized as the people you go to for help, like whether you're looking for a job or you're wondering what to do about your kid's school or whatever. And once I learned about those kinds of people, I realized, oh, sometimes they're attached to organizations, sometimes they're not. But there is a force in a lot of communities who are responding to the pain and hardship that families are facing. And that was really exciting. And that's what brought me into this work.
And communities can be defined in so many different ways. I know that, your mental health interests and experience, and then your interest in communities kind of came along in a connected but duplicate path where, like, professionally you were working with nonprofits and everything, but even in thinking about the personal family aspect, you mentioned that you're a child of immigrants and that your father's family had also been displaced even before he
Mhm.
immigrated to the US as a refugee,
Yeah.
correct?
Hmm.
And that it's really some of these traumas that probably influenced his mental health outcomes. And I think that that is something that can resonate across communities, whether you're an immigrant, whether you're a refugee, whether you and your ancestors have lived in the same place your whole life. There is intergenerational trauma in terms of how the hardships you face, whether they're economic, political, violent, um, affect you, and then how that affects your children and their children. And you mentioned, the big events of the 20th century and
Hmm.
how they affected the people that lived then, but I think they also affect the people that live now in ways we don't know
Yeah.
because of the ways that we grew up observing our parents and not understanding why they behaved in certain ways, maybe because of the ways our grandparents don't talk about these things. They're
Hmm.
just not used to. And I think mental health, when I was growing up, at least was a taboo. We
Hmm.
didn't talk about it, at least in Lebanon, as much as we do now.
Hmm.
So that's definitely something I want to point to. Um, and also, a couple of weeks ago, I had a guest who didn't make it to the podcast because she got a virus and had to Zoom into class, but her work was creating Indigenous circles. She works with low resource bilingual communities in New York State,
Hmm.
but they're mostly like immigrants. She's a Puerto Rican immigrant or child of immigrants. And she was trying to bring back that ancestral wisdom of, like, coming together
Hmm.
because her hypothesis also was that social fabric is so important. And that's kind of
Hmm.
what you're saying, like, can communities come together to tackle mental health? And so she used these Indigenous circle practices to help people navigate health and understand health. And in her case, she kind of meant like chronic disease and the US healthcare system and all that. But I think mental health is a really important part of that and should either be included with primary health or at least focused on separately, which is what it seems that you're doing. But I just wanted to speak to this point of the universality of mental health,
Hmm.
even if people don't think that they care about or invest in or even know about mental health, they
Hmm.
do because it affects every single human and every single community. And it's not just about a psychiatric diagnosis. So I
Hmm.
definitely wanted to make that point. And I know you shared with me that the first community based organization you visited was in Ecuador. And it wasn't a mental health organization, it was a community development organization. But then the community leader told you that a lot of people are coming to her with mental health problems. And I think that's kind of how it all came together for you, right?
Mhm. Yeah, I think one of the things that you pointed out is so important that, yes, like there's a prevalence of mental health. And we know now, like with some of the most recent research, that, they're estimating 1 in 2 people globally will experience poor mental health at some point in their life, right? Like, so maybe not for a long period of time, certainly not all at the same time, but at some point. And I think what that really tells us is that life is hard for people. And we all face different challenges and pains in life. All kinds of things happen, sometimes related to our choices, oftentimes not. And so, what's interesting about working with communities on mental health is that you're right. I think a lot of communities don't necessarily use diagnostic language, which we often do here in the United States when we talk about mental health. But they are more than willing to talk about the things that are important to them, right? So that sort of positive side of like, well, what does it mean to live a good life, in this community, or what's important to me, what matters to me, what has felt worthwhile recently, and they're also really willing to talk about the things that have gotten in their way, the pains of life, the things that have been really challenging, and so I think when we consider mental health as maybe just its language for the fullness and broad range of the human experience. It captures some of that inner, potential for moving towards those things that are important to us, toward our values, and also all of the other like more difficult experiences that we hold at the same time.
And, in some cases, it's that you're in the global south, or you're living in poverty, or your family is a migrant or refugee. In other cases, it's just that you live in a really well resourced setting, for example, in the US, but you're lonely and isolated.
Mhm.
The outgoing US Surgeon General a couple of months ago wrote a report where he called it Prescription for America,
Mm.
where he said, like, we need to tackle this issue of social fabric. People
Yeah.
are isolated from each other. People are lonely. Our communities and our societies are being eroded
Mm.
in a way that it just everyone's like sitting at home with their screens all
Mm.
day, and that takes its toll on your health, not just your mental health, your overall health. I think he pointed to a study or a statistic that said that being lonely and isolated has the physiological impact on your health the same as smoking 15 cigarettes a day.
Mm.
I don't know where
Mhm.
that came from, but again, just to emphasize, like, this is something that affects everyone.
Yeah.
So now we've talked about the general background and why it's important. Now let's talk about your organization. I almost said your startup, but it's been 7 years. So this is a mature organization. It's not a startup anymore. So congratulations on that. So your innovation is that you partner with these community-based organizations where the need is coming from their community. They may not necessarily be mental health focused, but they are invested in the mental health of the people they serve.
Mm.
And some of them serve the community through economic development, some through education, potentially some through specific mental health services. So what I understand is that you co-create, you like partner with them to design and strengthen their offerings. And then once you have proof of concept, you find ways to scale that beyond the organization, for example, to implement it in the government.
Mm.
So let's next look at a specific example to make this more concrete. So I know the case you wrote for this week's class, Kshamtalaya in India, is actually an education nonprofit.
Mhm.
So what's the story? How did they
Yeah.
connect with Brio? How did they end up working on mental health? What was the pilot that you helped them design and innovate? And then I'll ask you about how you're thinking about scaling it.
Mhm. Yeah, I think part of our mission as Brio is to make mental health more accessible. And so, for that reason, we partner with organizations that believe mental health is critical to the mission that they have in the world, but are not necessarily mental health
Yeah, their mission
organizations.
might not be mental health, it might be education, but
Mhm.
then they know that it's an important part of it.
Yeah, it's a big component for their participants and for the kind of impact that they want to see. And so, yeah, so part of our work is integrating mental health into the social sector more broadly, and we do that through these deep partnerships. So, Shamtalaya was founded by an Acumen fellow named Vivek, and Vivek found me through Acumen. We had both done programs through that network. And we started partnering almost 5 years ago, which is really exciting. The first initiative that we worked on together, this was in 2020, so early COVID, really scary time. There was a lot of confusion and uncertainty. Everything had shut down. And in the education system in India, in Rajasthan, where they were working, the teachers had been essentially converted into like community health workers, right? So they were trying to do some, virtual teaching, but you can imagine with low access to data and internet in some of those settings, there wasn't a lot of online education going on. And so the teachers were tasked with things like going from house to house to make sure that people were staying at home. And, this was a really confusing time. Again, it was very scary. We didn't really know how COVID was spreading for a while. Remember like wiping down our groceries.
I
And,
remember that.
and there was like all this confusion about like, should you wear a mask? Should you go outside? Like, all these things. And so it was very scary for the teachers to be converted into like a health workforce. And so Vivek and his team said that they wanted to do something for the teachers. And they'd already recognized in their previous work with government schools that a teacher's ability to show up with compassion, with kindness, with dedication is really a determining factor in the quality of education that a child is going to receive. And you think about that as like, oh, that feels obvious. But, there was no one investing in teacher well-being. And so they said, well, this is a good time to help teachers feel less alone in this scary moment in our history. And what if we created like an audio-based teacher well-being program? So that ended up becoming Hausla, and it was a 21-day, super low tech, delivered via audio and radio and phone calls, in the early days of well-being sessions that teachers could listen to. And there was a story, a reflection, and some skill building, a little bit of
Like their
teaching.
own personal podcast.
Yeah, basically, that they could listen to and just apply some of these like very simple grounding, settling practices throughout their day. It was a kind of a one-off initially, but it was hugely popular. We actually don't know how many people have listened to it because we open sourced it at the time. And so we do know that, there was I'm skipping a couple of years here, but we ran some evaluations, we improved it, we added like a live facilitation element. And then at the end of 2023, the state of Bihar actually took it up. So 120,000 teachers received this through a government integration at the time. But that was really a precursor in a lot of ways to thinking about, how do we help the government education system, which is Vivek and his team's goal, to get more serious about mental health and well-being. That was one of the areas, the levers of change that was important to them. In addition to like improving pedagogy, like really helping teachers show up and teach better and to improve the quality of teaching in schools, but also to improve well-being for children and for teachers, right? So this was something they wanted to do. And so now I'm going to talk about the curriculum and the children's well-being program that we ended up designing together with the government. And so back in 2022, the Kshamtalaya team came to us with this idea that, there's this new national policy as of 2020 that children not only learn basic academic skills, but also receive education for their social, emotional, and ethical capacities. And so national policy says this, but doesn't necessarily say, here's what it needs to look like. So it's the role of the state to figure out, how they're going to make that happen in their education system. And so the pitch was like, why don't we work together actively with the education department of Rajasthan, where Kshamtalaya had been working for 8 or 9 years at that point, to create a children's well-being curriculum and also an approach to training teachers to deliver this.
This is so interesting because the pilot was kind of a teacher well-being program, right? That was Hausla. And then in terms of thinking how to scale it, the opportunity to partner with the government was like, how do we take this innovation and make it into a children well-being intervention that the Ministry of Education would then implement. Is that the idea?
Yes. And it came because the education department was so bought into Hausla that they felt that this kind of content was exactly, what they needed in the classroom itself. So
So it's not
beyond,
only to help the teachers deal with being community health workers during COVID, which is how it all started, but
yeah.
like, okay, let's integrate this into the formal education offerings that we have for primary school children.
Yes. And so because of the success of that program and how much people really loved it, Kshamtalaya was invited to be a thought partner with the government to create a well-being program for children in primary grades 3 to 5. So that's that's age 8 to 10. So these are young kids. We're not doing Hausla with the kids. It's a completely different program. And what was really remarkable about how this all started was that, Brio and Kshamtalaya, we had been working together on frameworks for them to use in the work they were already doing with children to really capture some of the life skills that they were seeing children develop in these programs, to really define contextually, what does well-being look like for a child, in this particular context. And so we'd done a lot of that groundwork prior to this. And so in working with the Rajasthan government, the government actually decided that they were going to invite Kshamtalaya as the key thought partner in creating this social emotional curriculum for children, which is, everybody knows what SEL is, so that's what we're going to call it. But I think it's
Socio-emotional learning.
yeah.
Okay. Not everyone knows that.
Oh,
Yeah.
sorry. Social
No, it's
emotional
okay. Yeah,
learning. And people there's a lot of different debates around social emotional learning, and I won't get into that now.
Okay.
But we did, work with them to create something that was going to be contextualized, that was really based on the experiences of children. And again, this was a really great example of how, when the government partners with a local civil society organization that has had a lot of contact with children, a lot of contact with the teachers, the exact ones that are in these systems, they can create things that are tailored and effective for that population. So the government ended up convening a number of workshops, and this was pretty amazing because they put their budget up for that. They brought in teachers to design this curriculum, and then last year we ran the first pilot of this program. Now the program is written for 3 years, which is really exciting. It's pretty extensive, and there will be at least one well-being class or session each week. So it's once a week for 3 years.
In the public school,
Yes,
wow,
across public schools. So it's pretty intensive, right? And that was a commitment that the government made from the get-go in terms of, well, what are we going to design? What is it going to look like? And so, of course, we can pilot for 3 years. We piloted one module, and it took part of the first book, the first year. And we did that from August to January. So it was a handful of months. So, of course, we didn't do the entire program, but we did enough to test a few things. One is looking at acceptability and feasibility. So actually, get a bunch of teachers together. There were 120 that participated in this pilot from different parts of the state and different contexts, and 2 main districts, but different kinds of schools within those districts. And we wanted to see, how do teachers respond to this training? How do they feel about the curriculum? How do they feel about implementing it? Does it make sense? How are children responding? And then, of course, looking at children's reactions. And of course, doing some impact measurement there as well, even though it was just a partial implementation. So that was the pilot. And then, I think things were going so well, in fact, and this is one of those things where you realize nonprofits and governments don't work in the same way. That, we were mid-pilot when in October, the Rajasthan Education Department, the folks that helped to write this curriculum, were seeing early positive results and getting positive feedback. And they were like, let's take this to the whole state. And, it's so funny because as a nonprofit that is sort of trying to demonstrate effectiveness, trying to say, okay, this is like iterative. We're going to make improvements. We're going to get feedback. We're going to integrate that. We were sort of like, we're not even done with the pilot yet. And so, I think it's like one of those interesting things that happens in public-private partnership and this kind of cross-sector collaboration where, the government has its reasons for saying, like, I think we've invested a lot in this. It seems good. Like, we have a deadline to meet. We have a launch that we're already planning.
Wow.
And let's
I thought governments are more risk averse than that. This is great.
they were like, let's just get this done. Like,
All
enough with this
right.
like piloting. So, it's funny because we, of course, are committed to creating programs that are effective. And so, I think there's a lot of there's a lot of collaboration and compromise and figuring out like, okay, so how do we stick to our commitment to make sure that the teachers really are getting what they need and they're giving feedback and helping us figure out, what should training look like for this curriculum. And also that children had a say in this. I mean, the whole point of the pilot was also to get children to tell us what they thought about the program and if they liked it. And if not, like, was there something we could do to make it more interesting, more exciting for them? I think in terms of that shift, that was a really, it was a surprise for us to be suddenly staring down a statewide integration and thinking about how are we going to support the government's process of institutionalizing this curriculum and the teacher training that was conducted in order to enable them to deliver the program. Just for scope, the primary grades 3 to 5, there are approximately 2.3 million children in that grade range in any given year. So it's an enormous number of kids, and there's approximately 120,000 teachers that also need to be trained across 33,000 schools, right? And so, going from 1,000-person pilot to many, many times that, and thinking,
Wow.
okay, how do we change the way
scale.
it really is? And, and we're the only partners that are working on this project. There isn't another local partner that's working with us on it. So it was a big leap. And, I think in a lot of ways it gave us a lot to think about since October of last year to figure out, how do we want to do this well? How do we do this well?
Well, I know that you also, in addition to your work in partnering with organizations like Kshamtalaya to pilot and scale these programs, you've also been doing research across multiple organizations about what does it look like to integrate and scale innovations into the public sector. And just last month, you were at the World Economic Forum presenting a report that you co-authored with, I think, an organization called Catalyst that aims to bring together social entrepreneurs worldwide to accelerate progress towards the Sustainable Development Goals. And it was such a treat to hear you present some of the findings of that report to my students today. And the way I understood it is that a lot of social entrepreneurs think about scaling as a linear process. You innovate and you integrate. And not only is the process not linear, but also it's not accurate to make the assumption that scaling is the right path. So those are two things that stood out to me from your report. First of all, scaling isn't always the path. There are pros and cons to working with the government. And secondly, if you want to integrate into government as your path to scale, it's not linear. It's cyclical. So tell us about that cycle. You came up with a framework. I want you to share it.
So I had a co-author, Sue Balasubramanian, and we decided that we were going to search far and wide for examples, real life examples of cases where civil society organizations working on mental health had partnered with some public sector to integrate mental health into that public sector. And so there are 7 case studies that we wrote, 6 countries represented. We tried to get as many regions as we could, of course, in those handful of cases.
And this report is publicly available?
Yeah, it is. It's going to be on the Catalyst Now website.
Okay.
And so, we really wanted to see, like, okay, so as you mentioned, as a social entrepreneur, social innovator, you're often told, like, ultimately, your end game should be to get the government or someone to replicate your program at scale, right? And then get them to do it, and then maybe that's when you exit and go live on a beach somewhere. Um, but I think, of course, that feels way too simple, right? The world doesn't work like that. And so, our hunch was that, like, collaborating with government has to be a process and not a punchline. Like, there has to be something that happens here. So let's find the people who are doing this and ask them, like, how it's going and how it works. And so I did it in part selfishly because I had a feeling
You
that
wanted
we
to
would.
figure it out for
Oh yeah,
yourself.
yeah. I totally, because last year we did this report last year, and I had a sense that, like, this children's well-being curriculum could end up getting adopted by the state, and I wanted to know, what are some other people doing, in this process? Like, what are some of the challenges they've run into?
Yeah, no one teaches you, here's how to partner with the government to scale your innovation.
Right, right. And, and the report takes a practitioner's point of view, right? And so, it's not necessarily about, like, who has the best intervention, or, should they have done this or not. It was more about, like, what is happening in the real world right now, and what was the process that, brought about some of these outcomes. And so you mentioned the framework, and it's a triangle. So, like, we've got innovate, integrate, and then the third one is sustain. And so there is, something that happens between, like, creating the initiative and designing it. And I should say, this isn't limited to grassroots organizations, right? Like, academic institutions can do this, governments can convene and create innovative spaces. That's happened. But essentially, there is some kind of program or approach to, in our case, like in mental health, that ends up, becoming presented to a government entity as, like, this is a way that you could integrate mental health into this sector, whether it's justice or education or health or culture, or anything else. And what's interesting, we all kind of can imagine what the innovation stage is. That's kind of that focus on community-centered design, on getting rigorous evidence, on testing, feedback, and just figuring out, like, what is it about this intervention that works? And, of course, the best ones are centered on the communities that they're designed to serve, and the community members are part of that design process. And then, when you go to the integration phase, like, this is the really capital-intensive phase where you're taking that innovation and you're mapping it onto the system and how the system functions. So there's a codification that's happening here. And it's easier for initiatives that were designed with that vision in mind, right? So if you knew it was going to go into the healthcare system somehow, and you had an idea of, like, where it would fit, that would be easier. Or if you knew, again, in our case, like, this is going to be implemented in classrooms, and like I said, the government was actually on board from the beginning in the creation of this. That wasn't always the case, right? So there are definitely some organizations that went to the government to advocate for the integration of certain programs or policies that were important to them and their communities. And, the integration phase is intense because there's an energy shift, especially if you're in social innovation space and, you know what it's like to be up at night with community members figuring things out. The life of a social innovator, a community leader, or civil society organization founder. And, once you go to a government institution, there's just a different way in which that institution works.
It's a different culture and pace and momentum, right?
Yes, it's that. And it's also just the fact that, like, it's a completely different kind of organization. And so, what the most successful initiatives did was they really figured out, okay, so how does the government work? And how can we work with how the government works, right? Because you're not going to change the institution completely. There might be some changes in the system that you can encourage or be a part of. But for the most part, like, it's an institution that uses a lot of extrinsic motivation, the same way that all institutions do, right? How do you get people to do things that are their job, not to do things that are
There
not
is
their
a way
job?
that this thing needs to be done.
Yes, yes. And
It's very
so
different.
So it's capital intensive in this integration phase because you're training the system on a new approach. People need to be trained on how to deliver a program, maybe, or how to evaluate, how to monitor. There might be like internal infrastructures, such as like reporting infrastructures or kind of additional training infrastructures. Maybe books have to be printed and distributed. Just the system has to absorb this. And it's pretty costly. So it's important, in all of these cases, we see that the government is ultimately the leader here. And for a lot of social innovators, that is quite a shift, right? It's something that was created in their context with their people. And now an institution is adopting it, and you're seeing all of that shift into like institutionalization mode. So, once that has happened, we're looking at a third stage. And this was the one that I felt most exciting, actually. And I'm calling it sustain. But basically, instead of exiting and walking away, which of course an organization can choose to do, but instead we saw some that stick around as thought partners for the government. So it's not the expensive, like, initial training up of integration. It's more that they're around to conduct research, to help the government adapt to changes in the communities that they're serving, to offer up best practices, and to innovate, actually. So there's almost a returning to that innovation posture, but you're doing it kind of in partnership with the government. And that's what allows some of these initiatives to continue to be relevant to the community, to continue to offer value. And, if done right, the organization partner can continue to provide that feedback loop for the government, which is, one of the specialties that organizations have.
Yeah, and going back to like my intro at the beginning of this episode, I was saying like during this part of the public health entrepreneurship course, we're thinking about what is the end game. And usually when people hear the word entrepreneurship, they think you build something and then you find an exit. You either sell it or you integrate it into the government if it's public sector or whatever. But you're saying maybe exit is not the goal. And maybe the point of public-private partnership, the way you're practicing it, is very different than, like one of my students mentioned, she worked in Qatar where it was more like a build, operate, transfer thing, right? And that's like a consultancy. It's not just that you want to scale by having the government implement your innovation. It's that you want them to keep innovating and you can be their partner in that.
Yeah.
And, it reminded me of something that you and I were talking about earlier about impermanence, in the sense that you don't even want to just design and innovate around the world right now, because by the time you're done, it'll be a totally different world. The world is changing so fast. You almost want to design for the future. So share some of your thoughts about that aspect of impermanence, because it's counterintuitive. You would think, by integrating into the government, we're making something permanent. But then is that really for society's benefit?
Yeah. I think the institutionalization conversation is so interesting because one of the motivations, I think, certainly of some social entrepreneurs and some funders, like there's a narrative of like, here's a bucket of money, like go fix this problem and fix it forever, right? We want this to be catalytic. We want this to change everything. And, on the one hand, I'm all for like ambitious funding and ambitious social innovation. I think like, if we didn't think we could make any difference at all, none of us would get out of bed. But I think at the same time, there's this humility we really need. We've inherited institutions that have some things that were really innovative and really quite beneficial when they were created. And there are some norms that have calcified from the past, right, that we know are not serving us now. And so the humility we have to bring to this is to recognize that, we might build something into a system And we also want to leave open the possibility for changing some of that, for it to adapt to the future. None of us can see the future, so we don't necessarily know what that's going to look like. But I think we should have the assumption that it's not going to look like it does today, right? And so, how do we maintain that level of humility in saying, like, let's try to, we're not going to be able to avoid completely calcifying the same norms today that feel great, that are not going to be great tomorrow. But how do we retain some of that flexibility? And institutions are not great at flexibility, right? Like it's, once you've kind of mapped it on, it's sort of like, this is the way it's going to be done.
Especially government institutions.
Yeah, exactly. And so this is a really tough balance to strike. But I think one of the things, again, as to why, like, I recommend and have seen like organizations that continue to be that thought partner is maintaining the relationship with government and saying, hey, like this new thing is happening in the communities. Like, here's how we suggest you respond to that, like in the context of this thing that we've created together. The thing about impermanence, I think also is, sometimes you make permanent things you don't intend to, and then other times you want to make permanent things that don't last as long as you want them to. And again, there's that humility that we need, right? Of like, okay, so, in our case, building this curriculum with the government, and for the next 3 years, figuring out how to really train the system on it and all of the people who are going to deliver it. Is it going to be around in 50 years? Like, I kind of hope not, because, like, I think 50 years from now,
it will be outdated.
It will be so outdated. I mean, in 10 years, like, I think we have to really consider, like, we've created things for the moment that we inhabit, and maybe the moment beyond it, right? But
just
but
a
I
moment.
think, yeah, but I think that's still worthwhile. I think it's not to say if you didn't build Stonehenge, then like, what was the point? I think a lot of people will benefit from what social entrepreneurs do today. And does it matter? Of course it does. Of course it does.
And that's what I think your framework gets at. And that it's kind of trying to have both, in the sense that you are scaling, but then you are continuing to innovate and adapt. And you have the cyclical process of innovate, which happens with communities at the grassroots level, integrate to get those innovations into the government to scale them and reach a lot of people, and then sustain, which in my mind is actually not about sustaining the innovation in the way it was integrated, but rather about adapting it and making it cyclical. So you keep doing the process of innovating, integrating, adapting. And so it's not really about exit. It's about forming this lifelong partnership with the government where you're helping them continue to innovate and adapt in a way that they wouldn't if there wasn't a civic sector partner.
Mm-hmm.
So it's good to end on that note of ambition, and yet also on the note of humility that you just shared. So I'm trying to have it both ways too. Thank you so much, Daisy, for sharing your work with us, for the grassroots work that you're doing in India, Ecuador, and around the world, for taking this eagle's eye view of multiple organizations doing this work to partner to integrate innovations into the public sector, and for helping my class and me think through it. We're so grateful for you.
Oh, thank you.
Thanks.